So we have manufactured a Omicron challenge agent, and to do that, their first activity is to get a clinical sample. So what we've done here is collected a clinical sample from somebody who has contracted the virus naturally in the community. So they would have naturally come across virus, got COVID, they've had symptoms, they reported that to us at hVIVO, we've collected their sample, and when we've taken that clinical sample and used that to grow a GMP or a medical grade version of the virus. This is a very controlled way of making the virus. And then once you've made the virus under good manufacturing practice standards, then undergoes extensive adventitious and safety testing to prove that the virus is suitable for human use and it has no other pathogens in there apart from, of course, the pathogen of interest, SARS-CoV-2 virus. And once we've done that, which indeed we have now completed that stage, we're then ready to characterize the virus clinically, which is what we're about to start now. So at that phase, what we're doing is asking the question, what dose of the virus do we need to administer to get a safe and reproducible infection in volunteers? Because, of course, we're trying to give the minimal amount of virus to cause an infection and do that in absolutely a safe and reproducible manner. So to do this, we'll start with a few volunteers, giving an incredibly low dose. If we don't see any infection, then we increase the dose and look at the volunteers again. And again, if we don't see any infection, we'll then progress to a third higher level of the dose until we get enough infection. As soon as we get infection in the volunteers, we then are able to say, okay, that's the right dose. And we give a slightly larger volume to more volunteers to then expand the N number and to make sure statistically we've got a robust amount of data then to move forward with the next stage. Once characterization is complete, we will know the dose of virus. We'll also have a good body of data for which to power the studies, i.e. to work out how many people are going to be needed to do the next phases, because our next phases, we are able to move immediately on with testing investigational medicinal products. So whether that be vaccines or therapeutics, and we hope to be able to doing that in the second half of 2025. So we'll then be able to write those protocols, submit them to the regulators and ethics. And once we have those regulatory approvals, we'll immediately be able to move on with that efficacy testing. So that's be a very exciting stage indeed. So we're going to be able to run this study in our brand new facility in Canary Wharf. Now, this is a fantastic new facility, purpose-built challenge unit by our team. And this really enables us to do the entire SARS-CoV-2 challenge study in our own unit because it's a very highly designed CL3, which means Containment Laboratory 3 study. So what that means is we're able to do this entirely in our own unit. Previously, when we've done SARS-CoV-2 studies, we needed to work out in the Royal Free Hospital because our current quarantine unit wasn't quite at the level to be able to take PSO level 3 pathogens. This new unit certainly can do that. It's a really high level, specifically designed unit to be able to do exactly this purpose. So the entire quarantine unit and the laboratories will be run at hVIVO's facilities. hLab service is going to be a critical component of this study, as indeed they are all of our challenge studies, because all of the key primary endpoints from the laboratory come from our hLab services team. So working out the viral load, which is using qPCR or tissue culture techniques to quantify exactly how much virus is present in the samples which we collect. All of that is done by our hLab colleagues. Indeed, a lot of the screening is also done by them, looking at how many antibodies they have and potentially even looking at T cells as well. So looking at the immunity and the virology is all done by our hLab colleagues here. So this new facility is going to be a great benefit to our clients because not only is it going to be the largest commercial challenge unit globally at 50 beds, but also because of the high specifications of the unit, able to take a very wide range of pathogens. So in addition to influenza and RSV and rhinovirus that we can do in our current unit, this new Canary Wharf unit is able to take CL3 level pathogens like SARS-CoV-2. So able to have that much wider range of pathogens in the unit. In addition to that, there's some other features of the unit which also offer to our clients. So for example, we're able to offer transmission studies. It's got an expanded outpatient facility, so we'll have a much greater throughput for doing vaccination studies. So all in all, it offers a much wider range of services to our clients.